A new study just out says severely overweight people carry a high death risk, but slightly overweight people may actually live longer.
As you might expect, the results of this study causing some controversy. Our doctor on call, Zorba Paster, joining us from his office in Oregon with more on this. Happy New Year, Zorba.
Happy New Year to you, too.
So what does this study conclude?
Well, the study was interesting, published in the Journal of the American Medical Association. It seemed to show that mildly overweight people, those are people with a BMI, and BMI, remember, is height over weight. BMI between 25 and 30 may actually be at a lower risk of death than people who are thin, and it's a very controversial result.
So is there reason to eat more then if you're not at that BMI? Just wondering.
You know, that's exactly what everyone says. What you asked is exactly the bottom line. No, I went and did some research on the study, and first of all, we have to look at the researcher. The researcher came out with a controversial study back in 2005, which implied the same thing. This was a study of studies, 1 million people in all, pooled together in an analysis. Some of that means it's a strong analysis, and some of it means it's weak because there are multiple studies. But some people criticize her as putting some of the patients in there who are actually ill. In other words, some of the people who are not overweight actually had heart disease, kidney disease, Crohn's disease, which is an inflammatory disease of the bowel, and so on. And other people also smoked. And we know that smokers often weigh less than non-smokers. So I don't think the jury is out on this. I would call this particular study rubbish and something that we should ignore, because basically, if you're going to go out and pork on those pounds, it is not a good idea.
Especially here in Wisconsin, we're notoriously a little overweight.
We are a hefty state. Let's face it, we are a hefty state.
Can we talk about the flu for a minute here?
Yes.
All right, I got the flu shot, and I'm recovering from the flu. I officially had the flu. What's going on with that?
Well, first of all, the flu shot is not perfect. It's about 80% effective, so about 10 to 20% of the people who actually get the shot are still going to get the flu. But if you've got the shot, the flu will not be as bad as if you did not get the shot. So that's the first most important thing. And the second thing is, the Centers for Disease Control makes a best guess as to what the influenza vaccine should be. Sometimes they hit it right on the mark, and sometimes they're close to the mark. This particular year, the influenza bug was smarter than the Centers for Disease Control. It's going to be a bad flu season, and frankly, if anyone has not gotten their flu shot, they should get it, because within a week or two, you begin to have an improved immunity.
And just to check, I mean, how do you know it's a flu? How do you know that it's, it's not just a bad cold?
Not easy to tell, but generally the flu gives you more muscular aches and pains, and for some people it's simply the worst cold they've ever had. So in other words, it's really how bad the quote cold is that helps you decide. We can't tell as doctors. Often what we have to do is do an influenza test to really see exactly what it is.
And if the symptoms first start, can you take the Tamiflu?
Tamiflu works if it started within 24, 48 hours, maybe at the outset 72 hours. But beyond 72 hours, it is not effective, and it's a waste of money to take.
All right, I think you're coming down on something, Zorba. We can hardly hear you anymore. Some technical, but I can attest that I got the flu, but it wasn't as bad because I had the shot. So get the shot.
Right, that's the bottom line. That is the bottom line.
All right,
that's right.
Stay well, Zorba.
Thank you. I'll try. Bye-bye.